Do you know what can happen when you grind your teeth? I thought it would be a good idea to spend just a few minutes looking at some of the possible issues with teeth grinding. I'm Dr. Scheurer from Tranquil Dental. And of course, when you grind your teeth, a lot of times people are unaware of the fact that they do grind their teeth. Oftentimes it can be at night. Sometimes it's a habit for someone who grinds them in the day when they're under stress or they're focused, so they're working on the computer or having a task that's they're very focused on. But oftentimes the grinding that you do comes at night. And we've talked before about how to try and protect your teeth from grinding that's done, but we didn't talk a lot about the problems and the issues that can occur from grinding your teeth. Some of them are the obvious, which is that you can break a tooth. So a part of a tooth, a point of a tooth can break off. And that's definitely one thing that can occur. Another is that as you grind your teeth, sometimes what you'll find is that your gums can recede a little bit. Sometimes you'll have bone that will be lost around the tooth. And sometimes the tooth can actually create an indentation in it. We call it an abfraction. And that's from the force that's being placed on the tooth itself. I oftentimes liken this to a wooden fence post that is in concrete, and if you're wiggling it back and forth, you know the place that it receives the greatest stress is right before it goes into the concrete. And so your tooth is very similar in that if you're grinding on the edge of your tooth structure, the place that receives the greatest amount of stress is right before it goes into the bone. And so it flexes, and as it flexes, it's not something that you see, but little bits and pieces of the tooth actually kind of dissolve right at the gum line there. And it creates this like V-shaped notch called an abfraction. One of the other things that occur naturally is that you have a wear facet, or you literally wear the enamel off of the tooth structure. So you have enamel on the outside of your tooth, and you can grind it so that you can actually see the understructure there, the dentin, with the enamel all the way around the outside, because you've worn a good 1.5 millimeters probably of enamel off of that tooth. At least if you're seeing the dentin there. But one of the things that can also occur is that you can have literal cracks in the tooth. So I thought this was a really good example that I could show on the scanner so that you could see some of the things that I see. So let me see if I can get a good view here of the scanner. Yeah, we're probably pretty good right there. So one of the things you can see in this case is that there is a little bit of recession right there. So the gums have receded a little bit. And if you look, for example, on this tooth right here, you can actually see that V-shaped notch. You can see the V-shaped notch over, you might be a little bit harder to see, but you can see them over here too. When you're looking here at the front teeth, you can kind of get a sense that there's like a V-shaped notch right there. I use the same term, actually a totally different V right there, upside down V, I guess. But you can see that that's actually created from the teeth. So this patient in particular actually protrudes his teeth or grinds them straight forward. So I'm gonna take the teeth off and on so that you can see. So here's the top, and so you can see the bottom kind of has this little wave in it right there. And when I put the top back on, you can actually see right where, when he grinds forward, he's causing that wear there. So that you can see that notch from grinding straight forward. If we look at the top teeth, you can actually see right here where they've been worn flat at the edge. You can see the enamel around the outside, and then you can see the dentin, like the yellower structure there. So that's the understructure that's usually all covered up by enamel, but when you grind off the edge, then all of a sudden you start to see the dentin there in the middle. One of the really neat things with this scanner is something called NIRI, which is near infrared imaging. So it's not an x-ray, but it kind of sort of gives you that sense of an x-ray. So if I push a little button here and we look, this is the top that we were just looking at with the notch in there, and we could see the wear facets at the edge where the enamel's missing. But if I place it probably about like this, I might have to adjust it just a little bit, and I take this looking glass here, you can actually see two things. Let me make sure you're seeing all the way down here. Okay, so here you can see the picture. That's a literal picture as opposed to the scan here. And you can literally see those two fractures, those cracks that have occurred there on those two front teeth. And then here in the near infrared imaging, you can actually see the fracture lines and you can see the depth of them. You can see how prominent they are. And I can take this and I can turn it just a little bit and replace that. And again, you see the depth of those fractures there, both in the near infrared imaging as well as the camera image there. So my reason for bringing this as a topic today is because a lot of times I think people feel as though when they grind their teeth, it's not a big deal. And I think it's important that you understand how much damage can occur. Sometimes it happens really more slowly, but sometimes it can happen really quickly. And so that's really significant. So that's why when I talk about grinding your teeth and having something to try and protect those teeth, it's really important. I thought it was a great image to be able to show and share with you so that you could see some of the things that I see. I always like to let my patients see those images, and so I hope that you are stress-free and not doing grinding that's damaging your teeth. But if you are noticing that you're grinding your teeth, then make sure that you're protecting them.